My name's Rose Anyango Odhiambo. I'm the presenter. I'm going to talk about an innovation that we did in Migori County, Suna East Sub-County. And my sub-themes were on the high impact of intervention for mother, newborn, child, adolescent, and youth health. Title was Roving Provider Services. My background was adolescent is a formative life, which is a formative phase of life where patterns are being developed and are put in place. So according to Action Aid or Global Action Aid for Health for Adolescent 2017, it is indicated that in 2016, the adolescent population grew to the highest, about 1.8 million individuals. That is the ages between 10 to 24. So this large population could not be ignored, both in economic or social environments. So a pre-project was done in Migori, was conducted by Jhpiego in 2016 in Suna East Sub-County, where it revealed that 84% of young people consistently prioritize privacy, confidentiality, and respect to treatment as what they want. And they also alluded that seeking contraceptives in the public hospitals is not very easy, where you get people that you know, like their parents, their mothers, they meet them in the clinics. They also lack privacy and confidentiality. And also, they also alluded on non-friendly providers, among many other reasons. So these are two community barriers that we get from contraceptives used in the facilities, bore the idea of roving provision. So it has objectives, and my objectives were to increase access and utilization of family planning among adolescents and youth through decentralized and informal services that I'm going to talk about in my sub-county. It also it had timely solutions to the barriers that were identified as we were talking to the adolescent. And another one was to reduce adolescent pregnancy that we had seen in our county, where we were at 24%, and which was high compared to the national one, which was at 18% that time. So how did we do it? With a pool of 8 volunteer nurses, we mapped areas where there was low family planning uptake, and those sites we were calling them SDPs. And in consultation with the youth, because youth said there's nothing for them without them. So in consultation with them, we mapped those areas, and the areas they were calling outposts. They were like adolescent meet areas, safe spaces, saloons, where you can get them go to saloons, and also in some homes. So again, we recruited the local peer providers, who you are referring to YPPs, who are also the link between the nurses and the adolescents. So these YPPs were selected based on what they did previously. So the young people, the young providers gathered the adolescent in their areas, and then they would call the volunteer nurses. So when they ring the volunteer nurses would go to them equipped with all the methods in their bag, and also with the information which is appropriate to the ages. So the services that could be offered were like implants, injectables, pills, all types of family planning, except before we were not giving IUCD because of the position where we could go, because we could go to homes and there's no coach where you could give IUCD. But now when we are talking, we are now able to give IUCDs because we have safe spaces where there are coaches, there are rooms. The safe spaces are in the ward admin's offices, where the safe spaces we've been given in our county. So volunteer nurses also had books where they could capture data, and then when they go back, they transfer the data in the SDP books. This is a picture where one of the volunteer nurses was on session one-on-one with a young person. And then down here we have a comment from a young person. She was saying, at first, I thought my mom would get mad at me when I told her you were coming to offer me family planning method here at home. I was surprised when she told me it was okay. Most parents do not want their girls to get family planning. I really wanted a method to protect me so that I finish my school. This is a young person who had delivered. She had a child, and she didn't want to get another pregnancy, and she also wanted to continue with her school. So results. Between 2018 and 2021, a total of 3,672 adolescents accessed family planning method. This was captured in the books that I had just said before there. Then this also increased family planning uptake, where we were at 54%, and in the last quarter of 2021, we reached 78% because of the innovation. Qualitatively, young people have expressed satisfaction with the services, since most of them do not get time to come to the clinic. But when you go to them, it is better for them. Additionally, roving provider services have reduced stigma related to contraceptive use among young people, and most people feel that still stigmatized coming to the facility to seek SRH services, including the family planning services. So my conclusion, the roving provider services have proved that young people need services near them. And also stigma, poor staff attitude, and infrastructure barriers still remain hindrance toward access of SRH services to our young people. So provider services can therefore effectively complement government efforts such as Beyond Zero that we have. Sometimes we go with them in the community, but now when you go alone, even up to home of a person, it complements. And then also it's very simple and replicable in other areas, because we have replicated this one to other sub-counties. As I said, I am a sub-county RH coordinator in one sub-county, but now like 3 sub-counties have already replicated the same. So my acknowledgement goes to the Migori County government, because they gave us the nurses who are roving. They are able to come from their facility to go out and to visit these young people. The Giamini, through Jhpiego, they did the pre-service research that gave us the idea. Then the roving provider nurses themselves, we appreciate them. And also my sub-county HMT that gave me time to do this. Thank you.